time now for another edition of Wellness Wednesday with Dr. Bradley Meyer of the Okoboji Wellness Clinic. Good morning, Dr. Meyer.
Great to be with you, Dave.
Man,
good morning.
Yeah, beautiful morning. Good day to be out grounding again and getting some vitamin D.
Wow. Yeah, it's early summer. Perfect day to get out there and get some vitamin D for sure.
Okay, oxygen. You were at a big conference in Texas, I think, talking all things oxygen.
Yeah. Well, you know, it was quite an event. The first time I'd been to the annual Academy of Ozone Therapy with Dr. Frank Schallenberger, a friend of mine that is doing great things in Nevada. We met so many incredible people there and learned so many great things, and such a breath of fresh air to be in a group with folks that are like-minded, many of them traditionally trained like I have been, MDs, DOs, that have kind of gone outside the box without a doubt, and many of them have their own practices and are going off script. They're still following science, but they're not following the big pharma algorithm, so to speak. So it's super refreshing. We got to share ideas, lots of hope, lots of healing stories, and a great chance for us to come back recharged. We went down there. My wife Carrie went with us, the nurse Nicole, and Molly Avery. And it was just a life-giving experience. And speaking of life, oxygen, and that was a big theme. Seems kind of simple, but that oxygen theme was woven throughout the 3-day conference, and that is something that many times we don't see it, but we certainly feel it when we don't have enough of it. And we can see it on folks that don't have enough of it. So sometimes we miss these things and don't think they're maybe related to low oxygen levels. But most folks probably don't look at somebody that's got wrinkles and say, they're low on oxygen. But that is one way, in fact, to say, yeah, they're not getting enough oxygen to their skin. So another big thing, Dave, is the SpO2. A lot of times you go to the doctor not feeling well, and you get that little thing put on your finger, that thing called the pulse ox. We did that a lot during COVID. Yeah. We feel pretty good if it's 97, 96, 95 and above. We're like, yep, good to go. Oxygen's great. Not so much. We feel better when it's there, but you can still have a score above 95, 96, 97% on that and still not be getting the oxygen you need. And there's a lot of different other ways to measure that. Well, number one, looking at somebody, and how are they walking? Do they have wrinkles? What's the coloring of their skin look like? But the pulse ox can give us a false sense of, yeah, things are good with my oxygen. So oxygen is going to fuel that metabolism that we talk about so often. And metabolism is how well we make energy, or ATP, how well we utilize carbohydrates and blood sugars. So when our metabolism isn't working well, all those things that can get us into imbalance, infections, diseases, can kind of take over, and we can start to not feel so well. We get sick, fatigue, pain, those kinds of things. And we want to again catch those things, measure those things, and treat those things. And one big thing, I know that we had Michael and Brady on recently. Michael Sheridan talked a little bit about the metabolic testing that we're doing. And that is one huge way for us to measure oxygen levels. And it's just a 10-minute test here at the clinic. And it gives us so much information. Tell us about your metabolic thyroid state. It can tell us what your optimal zone is to burn fat with exercise, cardiac health, heart health. But it's just a quick 10-minute tool that is going to give you lots and lots of information. So call the clinic about that. That's an exciting tool. But again, another way to measure how well is my body oxygenating. The other big thing, of course, it was an ozone conference, and so there's a movie coming out now. There's a couple trailers being produced. My friend Dr. Schallenberger is on one of those trailers, so you can go to O3 documentary, and there's an 8-minute clip. It is absolutely gives me goosebumps when I saw that they showed that at the conference, and it really kind of boils down, what is that ozone stuff that I've been talking about for injecting for pain and for inflammation and for oxygenation? What exactly is that stuff? Why aren't more people doing it across the country? And that kind of gets into that in that little clip of that documentary O3 trailer. But boy, you watch that and you'll understand it better. And we're going to talk more about ozone coming weeks, but you'll be wanting to get some ozone therapy in a big way. And you'll be asking, why isn't everybody doing this? Because it's so good for us. Number 3, beyond the ozone, I was pleasantly surprised how many clinics across the country, my friends and colleagues, Dr. Minkoff, great guy down in Florida, talking about oxygen. He has got a room full of hyperbaric chambers in his clinic. So do not forget, again, how valuable those hyperbaric chambers are. So whether or not we're bathing your body in oxygen from sitting in a pressurized environment, remember how that is such an amazing tool for inflammation to help fuel the body, to get the body into balance and get the body on the healing path. And we have so many folks that just over the years here, 3-4 years, that we really focused on hyperbarics. We still do, but they utilize those just kind of for that maintenance, that recharge. They come in and learn more about it, get 20 to 30 hyperbaric treatments to kind of stoke the fire, get that engine roaring again, feeling better, more energy, less inflammation, and then they get to the point where they get into that maintenance zone. So a lot of folks will go to our chiropractor friends and go there for periodic adjustments. Think of it as an air adjustment, a pressure adjustment to the body, that once you've gotten in some of those hyperbarics, you get that cumulative effect, sitting in this wonderful chamber where we give you pillow blanket service and an incredible staff, incredible team. And then, just like our friend so many months ago that said, I'm starting to spit again because he had dry mouth. I'm spitting again. I didn't expect that with the hyperbaric treatments. And then my hip pain got better and my back pain got better, and then to the point where that is used for him as a maintenance, coming in once or so a month just to maintain the gains and help with that inflammation and that pain level. So just exciting times, as we've talked about, Dave. We've brought back a lot of different. We'll be bringing in more and more different tools and modalities as we go forward to help the body oxygenate. There is one topical application and IV and oral application of a particular treatment that is cutting edge, that is something that we'll be implementing too, that kind of fits into the ozone genre. So just a blessed experience. And just remember, Okoboji Wellness Clinic, we want to reduce that inflammation. We want to get that oxygenation maximized, and we want to be getting you living to your best. It's thriving, not just surviving, as we talk about, Dave.
Yeah, absolutely is. And you talked about being a little outside of the box. I think what happened is during COVID, a lot of people started, especially in the medical community, started to do some of their own investigation. They had always previously, even some of the most outspoken people now, had previously just kind of taken it for granted that what people were telling them was the truth. And they went out and did some of their own investigation and found out, that's not right. And so they started doing some of their investigation. And so, you say outside the box, but, some of these therapies like hyperbaric and even ozone, these are not brand spanking new treatments by any means.
No, not at all. And so these things we're practicing medicine again.
Yeah.
One of those other trailers that was on there with outside of my friend, Dr. Rowan, and he talks about the Flexner report that came around in the 1920s that really was pushed by Big Pharma, and that had a big impact on the doctors. The doctors at that time were doing more homeopathic medicine, doing alternative medicine, using a lot of different tools. And then things got pushed down the track of just Big Pharma all the time, and so a lot of these therapies, you're right, they've been around a long time, and now what's exciting is you got a group of doctors that are we're doing clinical trials, case studies with our patients. This is all science-backed, but we're not, randomized double-blinded studies became the standard in animal trials. Those tests cost hundreds of millions of dollars. And so it's not practical. Number two, you can't patent ozone. You can't patent Mother Nature, so the industry can't make money off of that. So what you end up seeing then is a propensity to get away from some of these more natural things. But when you get a group of doctors, for instance, a big thing right now that topic at that conference was spike protein coming naturally in the environment from COVID or from the COVID vaccine, and got to chat with Dr. Robin Rose. She's a gastroenterologist. She's working with people all over the country and all over the world on this topic and what she's seeing in tissue, spike protein in tissue, and how do we get it out of the body. We're acknowledging these things, and we're utilizing treatments such as IV ozone, polyphenols are a good example. We got to pull that spike protein out, and then we got to treat that immune system and get that body back on track so it can not only we get it out, we want to clear it, and we want to repair the damage from it. And there's active studies acknowledging exactly that in doctors across the world right now. How do we treat that? And again, it's utilizing, and many times, different herbals, different off-label medications. Again, ivermectin's been used at times, for instance. And then oxygen, again, as we've seen here at the clinic so many times, ozone therapy, hyperbaric therapy has been huge for folks that have had that spike protein injury. But remember, it's not just all about the spike. We're exposed to all kinds of toxins of all varieties over our lifetime, whether it's viral infections, bacterial infections, whether it's microplastics was a big topic, heavy metals. We are under constant siege. And so we want to give our body everything it can, all the tools it can, nutrient support, oxygen support it can to bring the body back into balance. And when we do that, and working with my friends and colleagues across the world with bringing in all these different approaches to help things that people normally think are not fixable. So let's help the body overcome things, autoimmune conditions. We want the body to get into a state of healing. And so that's what we're talking about. Why not dream big? Why not say these things that traditionally we have to accept as, that's unfixable? That was a theme there as well. It was like, no, we're not going to accept that this is the answer, that there's nothing else to do. So, one of the doctors said there's always more to do, always more to do. There's always answers.
Yeah, so we're way over time, but let me go way back to when we started. Somebody had come into you, an older lady with a foot drag, if I recall right, and she had been to many, many people, and they all said, "Nah, that's the way it is. Too bad." And she would not accept that diagnosis. and she came to see you. You got her down the road with the hyperbaric treatment, and her foot drag slowly but surely disappeared. And sometimes you got to be your own advocate.
Yes, absolutely. Be your own advocate. You don't accept less for yourself. We have a great team that's here, all like-minded, wanting to walk alongside you, support you, and see you at your best. So that's what we all deserve.
All right. How do folks come see you, Dr. Meyer?
Give us a call, 712-339-6024. I can do a complimentary discovery call for 15 minutes to kind of answer any questions you might have about what it might look like to start some treatments or down a path at the clinic here. You can find us at 3305 Berquist Avenue in Spirit Lake, Iowa. We're just off Highway 71.
Very good. Hey, a topic I want to tackle sometime, much like you talked about that little thing you put on your finger to read the oxygen. Sometimes it might read right, but you still might be not where your oxygen should be. I was listening to somebody talk about magnesium this week, and they talked about how the fact that, the magnesium that is read in your blood report might show that it's okay, but magnesium needs to get inside the cell, and that might not be okay. And so you got to have somebody that knows that, there's a difference. And there's some tricky things, and I know you are very well versed in supplements, so we should kind of talk about that someday too.
We'll do it.
All right, very good. Dr. Meyer, as always, thank you very, very much. Have a great day.
All right, thanks. Be well, everybody.
Thank you.
Bye-bye.
Dr. Bradley Meyer with the Okoboji Wellness Clinic. You can find out more at okobojiwellnessclinic.com.